I had hip issues earlier, some time ago, and problems got worse the last 2 years. So I decided to have surgery. I'm very sporty. I practice 5-6 hours a week. I also played football at a high level for 35 years. I was a goalkeeper, and I believe that the multiple and repeated impacts I underwent made my hip problems get worse. This condition is known in my family. Indeed, my mother already wears a hip implant, so that's something I'm familiar with.
A hip implant is often required in all cases of hip joint deterioration. These circumstances can be traumatic as they're related to diseases or intensive sporting activities. A hip implant is often necessary when one has an intensive sporting activity associated with joint malformations. In practice, people of all ages may require hip implants. They can be in their 40s or older, but even younger in some cases.
The first symptoms appeared 20 years ago. In fact, the first symptom was stiffness, which is neither annoying nor painful. We're not really aware that these pulling sensations have been present for several years until one day, when you walk and feel pinches as if you were being stabbed in the leg. It's at this moment you realize there's a problem. After a quick X-ray session, I was asked if I had had hip issues when I was young, which wasn't the case. Moreover, when I played tennis, I could barely move more than 1 meter on both the left and right sides, and I could feel pains in my back and knees. The pain and nuisance was so important all the way to the ankle that you'd ask yourself if it had affected and infected the whole limb. Very shortly, in less than a year, I could hardly walk properly.
The first consultation is essential. First, it's the confirmation of the diagnostic to phase out diagnostic errors or troubles that are not originally related to the hip. And then we define with the patient his expectations and objectives in order to consider with him the most adapted treatment. If the treatment requires an implant, we are compelled to discuss this matter in depth to know which technique to use according to the type of implant required and what to expect afterwards. The patient's demands are constantly part of the conversation and play a central part in the setting of the surgical targets.
The surgeon made it clear from the start that an operation was needed. He convinced me to have it when he told me that there was nothing better to do. Indeed, had he suggested I have an injection to add cartilage, which is common practice, I would have done it, but it wouldn't have resolved the problem in the long run. I'd reached a stage where I couldn't walk anymore, so I had to do it.
If someone intends to have a customized implant, then more developed examinations are required than for a standard implant. Standard implants are programmed on two-dimensional X-rays. Custom implants need a CT scan to allow the three-dimensional reconstruction of the hip. This reconstruction will be of actual size. It's absolutely essential that choosing to opt for an implant must follow complete psychological maturation. It would be a very damaging and harsh situation for the patient if he endured any pressure from the medical profession or surgeon to choose a radical intervention such as a joint replacement. If 2 or 3 consultations are required, we need to take time to reassure the patient on his current situation and tell him that he is not an isolated case, that many people live with an implant. Also, the patient needs to be reassured on his later ability to carry on with his life, activities, sport and work.
No one forced me to do it. I consulted my doctor several months before making my decision. I didn't just throw myself into it after the first consultation saying, right, it needs to be done now. I took the time to think about it before deciding what to do. I had the operation in October, whereas the consultation took place 5 or 6 months earlier. Thus, it was my decision.
10 minutes avant l'opération, il est venu...
10 minutes before the operation, the surgeon came to me and showed me the boxes and gear, which reassured me even more about the surgery.
J'avais pas d'appréhension par rapport à l'opération.
You know when the pains get so intense that they can't get worse? We don't want to give up. And the closer the operation is, the more serene we feel.
On est serein.